Okay, we're going to look at some arteries here. So we see this very large artery coming rostral, since we're in the neck, cranially in the neck, right next to the trachea. So that's going to be the common carotid artery. And we're going to skip a couple of the branches right now that are coming off the common carotid, and we're going to come straight up here to where we see the common carotid splitting into and giving off this very large artery going up to the base of the skull and coming in right next to a lot of these nerves in the area. That's the internal carotid artery. At that point, the internal carotid branches from the external carotid. So the common carotid becomes the internal carotid and external carotid. The first branch off the external carotid comes off right next to the internal carotid usually, but goes more caudally towards the, almost like the occipital condyle area, and that's the occipital artery. Next, the external carotid continues up towards the head, and we have this branch right here, which is leaving the external carotid and going ventrally. That's going to be the linguofacial trunk. And it's in this area, in the equine, that we will find this artery, which is the ascending palatine artery. It's going to come over here towards the muscles of the soft palate. So what we're going to do is I'm going to flip this head over to the lateral aspect, and we're going to continue to trace that external carotid artery and find some of its branches here. So now what I've done is just pulled back some of these muscles out of the way, allowing you to see that external carotid come up, and it's going to give off, again, this linguofacial trunk artery. And the linguofacial trunk artery in the equine is going to give off the lingual artery and the facial artery. The lingual artery will go into kind of the middle of the tongue, into those proper lingual muscles, and terminate as the deep lingual artery. The facial artery will come, and we're on the medial aspect, or would be on the medial aspect of the mandible at this point. And the facial artery is actually going to give off this artery that's going to go towards the bottom of the tongue, or the underside of the tongue. And that's the sublingual artery. The facial artery will then wrap around that angular or incisure for facial vessels and continue right here. So here we see that facial artery coming around that angle for the, or incisure for the facial vessels. Now we see the first branch of the facial coming off and going to the lower lip. That would be inferior labial. We then, facial artery continues dorsally and will give off this artery right here, which is going towards the upper lip. That's going to be superior labial. We then continue up and we see this artery right here come off, and this artery is coming towards the nostril. So that is the lateral nasal artery. The facial then continues and is going to give off an artery right here that's going to come up right towards the nasal bone. That's the dorsal nasal artery. And unfortunately, we can't see the angularis oculi artery because this muscle is still intact, which is totally fine. But that artery that would be wrapping up towards the medial canthus of the eye would be the angularis oculi artery. With all of these arteries would be veins that would be accompanying them. Okay? Now we're going to go back to the deep head. So that's looking at the linguofacial trunk artery. Let's come back to our deep head and continue. So just to reorient, here's our external carotid artery, our linguofacial trunk artery coming off, and our external carotid is continuing up here. And we see this artery that's actually cut. That artery was going into the masseter muscle So that is the mesenteric branch of the external carotid artery. We then see this artery that's going towards the caudal aspect of the auricle. So that is caudal auricular. The next artery to come off the external carotid is the superficial temporal artery. And the superficial temporal artery is going to give off two arteries, one towards the rostral side of the auricle, or rostral auricular. And then this one right here that's cut, but we would be crossing over the masseter muscle, over top of the masseter muscle, superficially. And that is the transverse facial artery. After the superficial temporal artery comes off, the external carotid turns into the maxillary artery. And the first branch off the maxillary artery is right here and would be running with this nerve. And both of those structures, inferior alveolar artery and inferior alveolar nerve. We also see, as the maxillary artery continues towards the skull, some tiny little branches coming off that are cut right here. Those would all just be pterygoid branches, so all of those would be going into the medial and lateral pterygoid muscles. We then see this really nice artery that wraps dorsally, kind of up around and into the temporal fossa. So this artery right here is the caudal deep temporal artery. The maxillary artery then enters, if I can pull this away a little bit, right there we can see the maxillary artery entering the caudal alar foramen, traverses through the alar canal, and within the alar canal it will give off another artery, this small artery right here that's again going up into the temporal fossa and is going to be supplying some of the temporalis muscle. This artery is exiting the small alar foramen, and so it's the rostral deep temporal artery. The maxillary artery will then exit the rostral alar foramen, and it's usually right around here that we see a large artery come off and go into the orbit. So this large artery down at the base of the orbit is the external ophthalmic artery. As the maxillary artery continues rostrally, it then gives off the buccal artery, which would be running with the buccal nerve, a branch of the mandibular nerve. Finally, we see here the termination of the maxillary artery as the descending palatine artery and the infraorbital artery. Now, to find the other branches, namely the minor palatine, which we can actually see in this cadaver, we see this minor palatine artery right here wrapping around the bone. It's not going into the bone, it's wrapping around the bone. Again, minor palatine artery. Unfortunately, we would have to remove some more of this bone in order to see the sphenopalatine and major palatine arteries.